Hey everyone, welcome to the latest installment of Phoenix Children's Live. I'm your host, Peter Balistreri, a brand manager here at Phoenix Children's for the Phoenix Children's Medical Group. Just want to give you a quick update. Coming up on May 19th, it's 8 a.m. to noon, is our annual 22q conference. You can still register, by the way. And this year's theme is transitioning from childhood to teen and adult care. We're going to talk a little bit more about that, but here today to talk with me about the 22q11.2 or 11.2 Deletion Syndrome and discuss this conference is Dr. Teresa Greevy. Thank you for being here.
Oh, my pleasure. Glad to be here.
We appreciate it. Real quick, we got to get this out of the way. It's May the 4th, so happy Star Wars Day, right? Are you a Star Wars fan?
Absolutely.
All right, we got it. No, we won't do Darth Vader, breathing
well,
today.
You can do it.
I can do it. Maybe later. But thanks again for being here. But really quick, as we always say, let us know that you're out there. Give us some likes, some loves maybe if you perhaps would be great. But don't forget you can leave comments or questions, and our capable colleague here, Jenny, behind the camera, will kind of jump in and give us some of the questions. Otherwise, we can always answer them afterwards, and we send them over to Dr. Greevy, and she'll be happy to answer those. So with that, let's get started. And I think the first thing I wanted to, right off the bat, is let's talk about this conference coming up, this annual conference. Because if you're out there and you kind of know what 22Q is already, maybe you just are really wanting to know more about the conference. So let's start there. It's open to really anyone that's interested in 22Q, but it's really about this transition going from child care to that kind of early teen and adult care. Without giving away everything about the conference so that we want you to come. Let's talk about the conference a little bit. What's it about, and kind of why did we do that?
Well, this is going to be our 4th annual conference. I'm really excited. And each year I've tried to pick a theme to focus on, but the conference really talks about all aspects of 22Q. So we really welcome all families and anyone, even care providers who treat individuals with 22Q or their family. I thought this year would be a good time to talk about kind of those later issues in life, because like many genetic conditions, 22q is lifelong.
Yeah.
And like many conditions that I treat, the issues that people face change with time. As we all know, life changes as we grow.
Right.
So we're going to focus a little more on kind of things to expect in your health and your well-being as you mature from teen to adult.
Okay.
So we're going to talk about kind of all aspects of that care, but we're also going to talk about kind of the things that parents might see in younger children. So it's hopefully going to be very informative.
Going to run the gamut, so to speak.
Yeah, and also recognizing that I think sometimes when families transition out of pediatric care, they're not quite sure where to go.
Right.
And our role here at PCH is to kind of provide them that pathway to success, as I like to say.
Yeah.
And find the adult providers or whatever things they might need when they leave us.
So you're speaking at the conference, obviously, right? But we have a couple other Phoenix Children's physicians that are talking. Dr. Stephen Pofall from our Phoenix Children's Heart Center, and Dr. Devinder Singh, who is from she's the division chief of plastic surgery. I think this is a good opportunity to talk about how that continuum of care works here at Phoenix Children's, and why they might be speaking, or why they are speaking at this particular conference.
Sure. They are 2 of my key team members on our 22Q medical team, as I call it.
Yeah.
And their role is there because of the prominent medical issues with 22Q that they treat. So the vast majority of kids with 22Q have some type of congenital heart defect, and Dr. Pofall's an expert in that, and also with 22Q. So he sees children and adults, so he follows children from infancy, up to adulthood.
Yeah.
Because there are some early onset issues. Some children need heart surgery as babies, but they need to continue to follow with their cardiologist, might need some procedures when they're older.
Yeah.
So he's going to talk about that, kind of things later in life to expect. Dr. Singh also, she's amazing. She is a craniofacial surgeon who I've worked with for over 10 years. Just really thrilled she's on our team. She's highly trained in 22Q as well.
Yeah.
And she helps us treat the speech and the palate issues. So
is that something that's connected to 22Q?
That's a core issue that up to 2/3 of children with 22Q are born either with a hole in the roof of the mouth, we call it cleft palate, or just a problem with the back of the throat, the soft palate, that it just doesn't function. And in infancy, that causes feeding issues. Later on, it causes speech issues. And again, so she's going to discuss the early treatment, but focus more on later issues down the road.
Keeping in with that theme.
Yes.
Yeah.
Yeah.
So, and again, that's why I asked Dr. Greevy this, because this is what is so important about our campus, is that all of these people are here and can help a child going through this particular syndrome. And that's the amazing thing about Phoenix Jones. So thank you for laying that out.
Team.
Yes,
Everyone's here.
that's
we
a
have
team.
A great team.
So we also have some outside folks coming in. I'm going to get to the keynote. I know you're excited about the keynote. But we also have Donna Powers from the Arizona Center for Disability Law. And then we have Emily Kyle from Kyle and Kapaszewski, I believe, law firm.
Yes.
I think I'm close. I got to be close.
Yes.
Let's talk a little bit about kind of what their role might be in the conference as well.
Yes, I invited both of them. I'm thrilled that they've agreed to speak. Again, in keeping with our theme of transitioning toward adulthood. So our first speaker, Donna Powers, is a special needs advocate called a STAT advocate and works at the Arizona Center for Disability Law. I've asked her to kind of speak on issues regarding disability and vocational training, later things that teens and adults can take advantage of. We don't want our children to graduate high school and not have a plan moving forward for vocational training.
Yeah.
There's different agencies that some parents are very well connected to, but other parents aren't aware of that, their children could benefit from and are entitled to receive. So from the Department of Developmental Disabilities, some of them may qualify for what's called ALTEX or Arizona Long-Term Care Services. So she's going to speak on those, and I've asked her to speak kind of on vocational and training, job training, and other things that they could benefit from.
See, we are getting everything smart. I like it. All right. So.
And Emily, Kyle, also want to mention her. I'm thrilled. She actually has worked with the Arizona Center for Disability Law, so they connected me with her. She is an attorney here in Phoenix in the law firm that you mentioned, and she has a special interest and expertise in the areas of long-term care planning, again, sometimes for people with special needs, but estate planning, special needs planning. So some of our adults go on to lead independent lives. Others may need more lifelong care from their families, so she's going to speak about guardianship, maybe medical power of attorney, and some of those more legal issues that may face some of our families, and helping them get things kind of in line. Because I follow some of my patients. I hate to say how old I am, but I do have patients who are over 18.
We won't go into that.
We won't talk about that. But sometimes, as being a parent, your kids grow up before you know it, and suddenly they're turning 18, and you realize, hey, they need some extra help, and I want to get things in place for them. So this is. I had this in mind to help our families kind of start thinking ahead and planning that, and because some of these things take a while to arrange.
I love that. I think it's important that, we're kind of expanding beyond just that clinical aspect of things, and we're really showing them that, with that, going forward, there's other aspects in life that, you're going to have to think about as we go forward. So I think that's great planning on your part for this conference. So let's get to your big gun, so to speak, Dr. Bassett, Ann Bassett. Let's talk about her a little bit. Why are you excited to bring Dr. Bassett?
I'm thrilled that she's coming all the way to Arizona.
If you're watching this, Dr. Bassett, she's very excited.
I did actually get to see her last week in Philadelphia at a 22q conference. But she's coming to us from Toronto, Canada, where she lives and practices. She is an adult psychiatrist, actually a full professor at the University of Toronto, and she holds an endowed chair in psychiatry and actually 22q.
Wow.
So she is one of the foremost experts in the world on 22q and the mental health issues that some of our families unfortunately face. Mm-hmm. So she's been doing a lot of research looking into how the genetics of 22q may play a role in increasing or reducing the risk of mental illness later in life. And so she's developed a consortium that's looking at that, the Brain Behavior Consortium it's called. She's doing genetics research in 22q. She started the first adult clinic for individuals with 22q. So I've learned a lot from her. I'm excited. Yeah. She's going to come in and speak again about some of the mental health issues. And, we know that unfortunately our patients with this condition are at a greater risk for mental health issues than the background population. But, our goal is to understand better which patients are at risk, how to recognize it early, because we know that earlier recognition improves treatment success.
Yes,
and
very
then
important.
And hopefully somebody how to prevent it.
Yeah. So she's very knowledgeable, and we're very happy to have her.
So I'm very excited to have her.
So again, don't forget May 19th, 8 a.m. to noon. It's at the Cohen Center here, right?
Yes, right here in the Rosenberg building on the campus. We'll have some signs, balloons.
There you go.
And if you haven't registered, definitely just show up anyway.
Yes,
we'll find room. We have breakfast.
Breakfast too?
Breakfast too.
Wow,
yeah.
This is good. All right, so for the folks that might be joining us today that don't know enough about 22q, but they maybe have a child or a family, friend or something along those lines that this has entered their world. Let's give a little bit of background on what 22q is now. So I think basically what is 22q? The big broad question to start us off.
Right. So it's a condition that's been known since the 70s, and it's gone by a lot of other names. So some families have heard it called DeGeorge syndrome after Dr. Antonio DeGeorge, an endocrinologist, who first described it then, before we knew the genetic basis.
Yeah.
It's been called velocardiofacial syndrome. It was discovered in Europe separately with other names, but in the 90s we found out that the cause of all of these different conditions is one and the same. So it's a missing piece, or we call it deletion, on chromosome number 22. And we say Q, that just sort of designates the exact area on the chromosome, the Q11.2 band. So when we have families in clinic, we show them pictures to explain exactly what that means.
So it's really gotten down to exactly a part of that chromosome.
Very specific. And our current testing, called a microarray, allows us to tell exactly what genes are missing in that region. So we've gotten it narrowed down very, very precisely, if you will.
Yeah.
So so it is genetic in that sense, but in most cases it really doesn't run in families.
Okay.
It's pretty rare that we see more than one affected family member. But that said, we do have at least 10 families in our clinic where there's a parent affected and a child.
Okay.
And sometimes it was the child diagnosed first, sometimes the parent.
So
both
it can go either way.
directions. Yeah. So I think initially it was more diagnosing the parent after the child, because a more mildly affected person with any condition, I see this across the board in my practice, that sometimes a parent is mildly affected with something and they never seek medical care, and so they have something they're not aware of. So sometimes we diagnose parents. But on the flip side, with our greatly improved cardiac care, our super cardiac surgeons, and advances in that treatment, our children with heart problems are growing up, living healthy lives, and now they're having children of their own. Yeah. So we have several of our young adults who have had children of their own with 22q.
It passes down.
So
right?
it can pass down. It's not 100%. So it's a 50-50 chance if a person's affected of passing it on.
Okay. So with that being said, I think then the segue question would be, how common is it? Because I heard you mention, obviously we have a program here.
Yes.
So, and a great program. And so I wanted you to talk a little bit about, what is unique to this program, but kind of lead into that with maybe how common this might be and why we have a program.
Right. Well, we're learning that it's much more common than we thought.
Okay.
And that's true, I think, for a lot of genetic conditions, because we're recognizing some more mildly affected individuals and we have testing for it.
Yeah.
The previous estimates and the published estimates are about 1 in 4,000 individuals.
Okay.
But we really think that it's maybe closer to 1 in 2,000. So if you think about the population of Arizona and Phoenix, that's, we're seeing maybe 5 to 10 new affected individuals born a year here. Okay. We've seen in our clinic almost 200 families. So I know we have on our list, I would say at least 200 individuals, some parents and children. We've just had 3 new patients born this year with it, and another 3-year-old. So I know 4 new patients I'm going to be seeing in the next few weeks.
Are there demographics? Are there anything that precludes a certain child, or is it just kind of willy-nilly
No, it's
how
not.
it happens?
That's a good question. Yeah, it is. I always tell parents it's just sporadic, it's spontaneous. Nothing anyone does makes it happen. Yeah. We all have something genetic. Yeah. You, me.
Right.
We all do.
Yeah.
So and we see it across the board in all nationalities. There's no one group that it's more common in. Okay. So we have quite a variety. So
what might be the signs and symptoms that we would see with a child with 22q deletion?
That's a good question. And so I mentioned before that Dr. Pofall may see them because of a heart defect. So a number of our children may be diagnosed at birth when they have a heart murmur or they're a little blue, and then they get diagnosed with a heart defect. We have quite a few diagnosed in our fetal cardiology program here. So they're diagnosed in the womb during pregnancy. So I've met with some pregnant moms who already know that their baby's going to have it. And that's, I think, helpful for parents to know ahead of time kind of what to expect, and we get them transitioned into our program right from birth.
Right. As you said, the earlier the better, right?
The earlier the better. It really helps out.
Okay.
Yeah. Some children are diagnosed because of the cleft palate that I mentioned that Dr. Singh might see them for. And then we have another group that has milder symptoms. They might not have either of those major findings, but then they might have something a little rarer. So low calcium is a common issue.
Okay.
We had a baby diagnosed recently who presented with seizures, and they did a calcium, and that baby's calcium was really low.
Okay.
And that led them to the diagnosis. So calcium and some other hormone issues are common in 22q. So that's sort of a rarer reason.
Yeah.
And then there's a subgroup of kids who luckily are not born with heart defects, not a palate problem. They might be diagnosed much later, maybe even middle school, when they're having a little bit of learning challenges.
Okay, so in that kind of that 11 to 13 kind of age group?
Yeah, maybe a little wider range. And so some of them are referred to us or to different specialists. So we see a lot of children and teens in our clinic for what we call developmental delay.
Okay.
And as part of our workup, we might do this chromosome test and find it.
Okay.
So we're broadening that spectrum of how you might be diagnosed. And immunodeficiency is yet one other symptom I meant to mention. So we have had children referred from the immunology clinic and diagnosed that way. So it's one of the most extremely broad spectra of types of symptoms you could have.
Is there any, and we kind of touched on this a little bit, but is there any child that is more at risk than any other to getting 22q?
Yeah, I wouldn't use the word at risk, I would say, but definitely if there's certain types of heart defects, if they're picked up prenatally, we know there's a very strong correlation with 22q.
Okay. You talked a little bit about it, maybe a little bit more detail. How do we go about diagnosing? What is the kind of the steps that we do to diagnose and kind of tell them, yes, this is 22q deletion syndrome?
So there's several genetic tests you can do. The old test we did years ago was a chromosome test. That basic test will not pick it up. So the newer test, the one that's easiest to get approved by insurance, we call a fish test, actually. And it isn't the fish in the ocean, but it's an abbreviation for a test that looks with a fluorescent probe. That's where the F in fish comes from. And it clings to that piece of the 22q. So a fish test. And that's something a primary care physician can typically order in the office, pediatrician, family practice doctor.
Okay.
Now we've moved on here more into that more specific test that I mentioned, the chromosome microarray.
Okay.
So that, or CMA. So that's the state-of-the-art test that we do.
Okay.
That really tells us not only that the deletion is there, but how big it is and how many genes. So it gives us more information. So there's kind of 3 levels of testing.
And does that help you then, because my next question was, once a child's diagnosed, can that help you then determine what kind of the treatment would be based off of what you find out in the test going forward?
What a great question. So not exactly, no.
Oh, okay.
What we found is, and across the board, around the world, is that the size of the deletion is usually the same size among all individuals. 2.55 million base pairs, as we call it, of DNA.
Yeah.
There are some people who have smaller deletions, and they have a better prognosis, but the vast majority have this same uniform deletion. So it doesn't explain why are so many people different with this. Why do we have the very mildly affected child who's diagnosed at 13 and then the newborn?
Yeah.
So actually we're doing a genome study here at PCH to look at that, and there are studies like this going on around the world to look at, there must be other genetic variables that are affecting that.
Right.
What we're looking at here in our families from our clinic, we're studying parent-child pairs, because we're seeing even in the same family where you might have an affected parent and an affected child, there's differences between the two of them. Even though they share 50% of their genes, the mom might have no heart problem and the baby was diagnosed with a heart problem.
Yeah.
And so there's definitely other factors that
a lot of variables
still to discover.
Yeah. So when a child is diagnosed eventually, we talked a little bit about it because of the conference, kind of going from child to adult. What does long-term care look like for families with children with 22q? Kind of how do you work with them, and what's their kind of outlook going forward when their child is diagnosed with 22q?
Yeah, I think that's a very hard question, one that parents always want us to answer when the baby's born, which I wish we could. But I tell everyone I don't have a crystal ball, and I really defy anyone. No matter what you're doing.
Because every kid is different, right?
Every kid is different. Life, has unexpected twists and turns, as we say. But there are guidelines that have been set forth in terms of medical follow-up, and Dr. Bassett helped create some of those guidelines. So there are some published guidelines we use for pediatric age patients and adults. And as we merge more toward adulthood, most of the medical issues hopefully have been covered, but we still know that there's a risk of intermittent issues like with low calcium, which can cause seizures and other things. So there's certain things we'll monitor for them: calcium, thyroid, blood sugar, a few other blood things we do on a periodic basis, vision and hearing.
Mm-hmm.
As far as outlook, for development, cognitive issues, we know they have a higher risk for some mental health issues, maybe depression and things, and some subtle learning issues. So we want to make sure they get into the right vocational training, and be successful in life. So again, there's a spectrum. So some of our individuals, one of our families, the parent is working full time. Several of our families, the parents are working full time, which is great. One of my oldest patient, I don't think she'd mind me mentioning, she's in her late 60s. She was in the Army. She's amazing.
Wow.
She's retired Army.
Yeah, that's awesome.
And she diagnosed herself. So that's
really?
how bright she is. She told the doctor to test her.
That's great.
She's amazing.
So there is really
there's
this
a
broad
broad spectrum. Some of our other individuals struggle a bit more and still live at home, or have part-time jobs or still need some help. So that's where we want to, really get patients where they need to be and make them as successful as they can. And I think getting them diagnosed early and getting them in treatment is really
that's a start.
Is a key.
Yeah. So that's why it's important to come to the conference so that you can hear, people can hear kind of what that journey might be. I think that's really important. Yeah. I'm going to give you a chance to talk about your program and the staff on it too. So that was one of my last questions. I do want you to talk about the program and who makes up this program besides yourself, and and then I'm going to ask you kind of the follow-up question would be, what are you most proud of, and kind of what are your goals then for the future of this program? I know you said you had the genome study and things like that, but it's kind of a three-part question. So start with maybe who makes up the team. Okay.
Yeah, we have a great team. I'm so proud of our team. I think we've got one of the best teams in the country, one of the most comprehensive teams. And it is a large team. I think we're the largest multidisciplinary clinic here at PCH because of all the variable health issues I described with 22q.
Yeah.
We started our team, as I said, 4 years ago, and I should say that one of the driving forces to get the team started were some parents, as often as.
We love that. We love that.
There are not many clinics such as ours in the country. I just had the great fortune to come back from the first inaugural 22q medical directors meeting at Children's Hospital of Philadelphia, where I met about 20 other directors. So not every state has one. We are the only one in our part of the Southwest, so there are none in New Mexico, Western Texas, San Diego. So we've seen families and patients from as far away as New Orleans and Alaska.
Really?
Some from New Mexico, Texas, So we have a big drawing area.
Yeah.
So I direct the team, and I have an amazing coordinator, Vanessa Stull. So she's the glue that holds us together.
Vanessa's awesome.
Coordinating doctors is like herding cats. I know that's an overused expression, but it is really true.
It is.
Ask her. So we have what I call our core team, and those are the doctors and specialists that the patients will see when they come to clinic.
Okay.
The clinic is a really intense day for families. They have to get here at 7:30. They're here all day till about 3:30.
Really? Wow.
But I really feel strongly the advantage of that is that, for lack of a better phrase, one-stop shopping. I mean, you get to see all the doctors in one day.
Yeah.
Parents don't need to take off work multiple days.
I think they'd be happy about that.
Yeah, so
sure.
hopefully that's a good thing, even though it's a tiring day. But we have snacks, and we give them lunch, and we have presents for the kids,
it's a good
courtesy
deal.
of our wonderful support groups. So we try to make it, as easy a day as we can.
Yeah.
So they're going to see our cardiologist in the morning, myself, either a psychologist or a psychiatrist. We have an amazing medical psychiatrist, Dr. Dragulich, who's been here not very long at PCH, but he has an interest in medical conditions associated with mental health issues. So he's fantastic. They see physical therapy, occupational therapy as well in the morning.
Wow, they really run the gamut.
So that's long, and that's all in the heart center, so that the families don't have to move around too far.
Right.
And then one unique feature of our clinic that I think is just great is that we have a room reserved where our families eat lunch together. We only have 4 families per clinic. Which,
you max out at that time.
Yeah,
okay.
we've done 5 at one time, and it's a very limited number, unfortunately. But really, we feel like to do a good job for the families, we can't see more than that in a day.
Yeah.
So at lunch, they get to meet the captain of our support group, Kelly Calcaterra. She's just fantastic. Kelly comes every week, and every month, I should say, it's once a month, and Kelly meets with the families and tells them about the support group. She's fantastic, And the whole support group has really done a lot for our clinic,
Yeah.
I want to say. It's their fundraising also that's allowing Dr. Bassett to come.
That's great.
So,
good for them.
we couldn't do this without the families, so hopefully we're supporting each other.
I like the fact that the families get to sit with each other. They can actually just kind of,
share stories and support each
networking.
other. To
Yeah.
me, I often say that's going to help you more than seeing the doctors.
Yeah, I mean,
Talking
sometimes
to
it's just
other
like, I just want to talk to somebody that's going through the same thing I'm going
Right,
through, right?
absolutely.
Yeah.
Much more helpful.
Last part of this question was, what are the goals for the program going forward, say, looking 2-3 years into the future?
Mm-hmm. I want to increase our support for the teens and adults because I think that there's always more support for families with young kids, and then I think that some of the struggles the teens and adults face are different.
Yeah.
So I'm trying to build that a little more in terms of social support. I'd love to get a social worker to help us. That's always a bit of a challenge. We want to see more families because we do have a long wait list.
Yeah.
So we have to strategize about how to do that. Maybe have the clinic more often. Some of the other centers in the country have fewer team members but see more patients.
Yeah.
I don't feel I can compromise that because we need the specialists. The afternoon I didn't get to mention, they see speech therapy, ear, nose, and throat, dental. We have a virtual team of specialists as well.
Wow.
So if they need other specialties that they don't see that day, I refer them.
Yeah.
So I try to coordinate the care after the visit. One of the unique things about our team is that after the families leave, at 4 o'clock, the whole team sits down and we go around the table and discuss what does the patient need.
Do like a debrief, basically.
We do a debrief, and then we take notes. I compile a team report, and any recommendations that the team says, I take care of them. So I kind of coordinate it all, as you will, and any follow-up.
Yeah.
I am Vanessa's help. So, I'm not a primary care physician, but in this role I kind of am.
Yeah, I was going to say, you
So
kind
I
of
want
are.
to make sure they get what they need. Sometimes there's a lot of referrals that we do.
Yeah.
So, I'd like to grow the clinic, but I still want it to be, the quality that we have. The national group that I just joined of the directors, our goal I think is to get a database going so that we can collect information and then better develop care plans. So we have some guidelines, but we want to improve on those. How can we standardize guidelines so that patients get better treatment, earlier treatment, better outcomes? And I want to track for our PCH patients, the ones we diagnose as infants, if we get them into therapies and treatment early, are they doing better by the time they're teens?
Right.
So that's my goal, is to track outcomes and improve outcomes.
That's excellent.
So,
Dr. Grebe, smart lady, thank you. Great doctor. Thank you for doing all your efforts. We appreciate that. So if you want more information on the 22q program here at Phoenix Children's, you can contact us. It's 602-933-2252, or you can email us. We have a really nice little email, 22qclinic@phoenixchildrens.com. So that's all the time we have questions for, but thank you for being here today. You did a great job. Thank you for giving us all the information. Register for the conference or just come that day. It's going to be a great day, talking all things 22q, going from childhood care all the way through teens and on to adults. And we are excited to have Dr. Bassett and all the other speakers as well. So stay tuned for more Phoenix Children's Lives coming up in the future as well.